My first involvement with healthcare was when I was a young consultant in England. I was born and raised in England. I got a master's degree from Oxford and then a master's degree from Yale and went back to England, became a consultant, and I led the teams that reorganized the Irish National Health Service and the Welsh National Health Service, separate operations.
What would you say to the average patient about this treatment and giving it a try? And
It's people who use it say that it is perhaps the most significant medical breakthrough ever.
You would agree with that?
I would agree with that. I accept that there is competition for that statement. I would assume that the competition would be vaccines and antibiotics. But this works when they fail, as they increasingly do. Right now, 500,000 people die every year simply because they have an untreatable infection. The bulk of it is sepsis, but you've got hospital-acquired infections, another 23,000. Viral pneumonia, all the MRSA, MERS, SARS. There are dozens now. Bacteria, of course, some of them can be cured by antibiotics. It used to be all of them could be cured by antibiotics, but increasingly the bacteria are becoming resistant to antibiotics, and that generates the so-called superbug. But antibiotics have never been able to cure a viral infection at all. Big Pharma's solutions to the problem are also causes of many other problems. And they simply don't deal with the major killers. The sepsis kills 200,000 people a year. It has a 30% mortality rate, and UBI was curing sepsis every case treated with it. And they're, of course, always in ICUs.
Why are people hesitant? Are they simply unfamiliar? It's not, there seems to be a little bit of that hesitancy. Can you explain why and why that needs to go away?
Well, a little bit of hesitancy is
putting it too mildly,
understating it. Yeah. The cynic in me says that it would have a major impact on the conventional standard of care. If you're an infectious disease doctor and suddenly ultraviolet blood therapy becomes available, right now your role is you've got to figure out, do you have an infection? What sort of infection? What sort of antibiotic will deal with it if it's a bacterial infection? And how do we try to keep you alive until the immune system cures you if it's a viral infection? The standard of care for a viral infection is literally that. Keep you alive and hope that the immune system will deal with it. Sepsis is much the same. 500,000 people dying every year unnecessarily, and millions more suffering unnecessarily. The people who recover from MRSA often do so with large chunks of their flesh missing, because the standard of care is just to cut away the infected tissue until you got rid of it all. UBI attacks it at the source. And the beauty of UBI, and you're seeing it a little more in conventional medicine, is that UBI doesn't cure you. UBI enables the body to cure itself. It triggers the immune system. It gives the immune system the information that it needs in order to be able to cure itself.